All right, so today we're going to talk about infections of the eye. So this is your last lecture in this block with me. No, we'll end the block. So as we usually do, we talk about our learning outcomes. So by the end of this lecture, expecting you to be able to identify the spectrum of the infection by anatomical side, list the causative agent, which could be like bacterial, viral, parasites, or even fungal. Recognize the characteristic signs and symptoms. So what the clinical presentation that the patients will come with, and based on that, select the appropriate diagnosis tool, and of course, apply. Yes, you don't hear me, and I'm a loudspeaker, so you don't hear me. People in the last, row, you hear me?
Yes.
So. All right. So when we actually talk about, the eye as, structure in our body. So one have to mention that it's very important to recognize that your eye is actually supported by innate immune. So you actually get protection because of the innate immunity. And not only that, you have lacrimal apparatus which actually produce, antimicrobial protein that's coming from, lysosome, lactoferrin, IgA. All this together, it give your eye the support, inhibit the possibility of get, infection. So this is your defense system, or the eye defense system. True? Not only the lacrimal apparatus, but also the structure of the eye. So your eye, lids, the covering outside. So if I actually think that I will be faced by some kind of if I'm just running towards someone, try to hit or throw something, the person automatically will blink, true? Or close the eyelid. So that's kind of also of physical production that cover a possibility of get something into your eye. Okay, so this actually both structure and physical barriers kind of helping the eye to be protected from infection. But we also know there is certain condition where any imbalance on what I just mentioned could actually lead or be a predisposing factor to actually initiate the infection. So if you get an eye dry, or if you get a trauma, or you get ladies, you wear contact lenses that could be contaminated. So these all would be actual reason to get an eye infection, and it could lead to something very serious. So depend on where and what etiological agents you get specific conditions. So if you get your conjunctiva affecting, you get conjunctivitis, true? If you get your cornea involved, you got keratitis, true? So it depends on also is it viral, is it bacterial, is it a parasite or fungal? So it really depends on both etiological agents and also anatomical side where the infection happened. True? All right. So when we talk about the ear infection before, we talk about we have a diverse microorganism. And based on this diversity, and now I also highlight depends on the location, you get different kinds of condition that more associated with etiological agent and also location where this etiological agent affect the regions. This is a condition we're going to talk about in details, but it's very important to be aware of what is the causative agent when it comes to eye infection. Why? Why it's very important?
Give the right
To give the right treatment. But something I would like to highlight at the beginning of the lecture. When we think of viral infection, it's always like a self-limited, true? So you get more of like supportive care, and that's it. But when you get like, bacterial infection, when you graduated and you go to your specialty and be like, and in the field of ophthalmology, you wanted to make sure that you actually differentiate between the eye infection due to bacteria or due to viral infection. Okay? All right. So I'm going to talk about certain conditions. So we'll start with I'm very sure you're familiar with structure of the basic anatomy of the eye, where you have the cornea, you have your oval sclera, you have your conjunctiva, you have whether it's superior to tersor or interior to tersor. So the first condition I would like to talk about is the conjunctivitis. So what is conjunctivitis? It's an inflammation of conjunctiva, which is what? Is the membrane, which is very transparent, lining the eyelids and covering the sclera, which is, very delicate, area. So what happened? You get an inflamed conjunctival vessels, and how it appears, the patient will come with redness or pinkish. So this is an indicator of inflammation. Is it at this stage I can tell, is it a viral or bacteria? No, I will not be able to tell. All I know that I have an inflammation in that region or inflammation on that region, okay? And the symptoms or the character I actually notice an inflammation is the reddish that's happening or the pinkish color of the eye. You done? Are you done? So I can continue? You both. Okay, so you cannot really tell, whether it's a bacteria or viral, but something also I would like to highlight is very important to know that both bacteria and viral are very contagious. So you wanted to make sure to avoid eye contact when you have an infection in order not to transfer it to the other eye or to someone else. So both of them are very contagious, and you have to make sure that you take all the personal hygiene care to avoid transferring of the infection to someone else or even to to other eye. All right, so comparing bacterial to viral infection or conjunctivitis. So bacteria is more common in children. Why children? Because they don't care. They're playing, they just put their finger and hand anywhere. They don't really even, they can just go to the bathroom and come and take something and eat or touch their face. So children they're more in control. Of course, parents try to do that, but still. So the most common when it comes to bacterial infection that lead to conjunctivitis is in the children. So if you have a bacterial infection, you will see a picture of purine, discharge. In case of viral infection, where both children and adults could be affected, you mainly see water discharge, and that could be bilateral, so it could be in both eyes, and there is no purine discharge. Okay? So this is the major differentiation between viral, infection. So viral infection is self-limited, as I said. So you don't really need to prescribe medication or give an antibiotic. So, but in case of bacteria, it's very important also, before you just go ahead and prescribe an antibiotic, it's very important to know what is the causative agent. Because we will discuss later, there's two microorganisms, if they actually cause an eye infection. They could lead into blindness, so you lose your vision. Excuse me, I mean, I just wanted to know what are you discussing the whole lecture. If you're not interested, stay out of the lecture and that's it. You both, yes. You just keep talking. This is distraction. If you're not interested, do your attendance and step out, please. No, you're talking the whole time. Man, I'm just in my face. Okay? So, it's very important to differentiate between, the causative agent even in bacterial infection. Why? Because, some bacterial infection could be actually treated with, a short course of antibiotic for 5 to 6 days, and that's it. But some need very specific, antibiotic for that specific agent, especially when you talk about trichoma, and Neisseria gonorrhea. So you have to take these two in consideration, okay? So, what is the type of conjunctivitis? So there is actually, different, appearance or different presentations, and based on this appearance and presentations, you can actually tell what type of conjunctivitis. So if you have an allergy or allergic one, the patients will come with complaining of itching. Let us agree on something. Redness is available all the time. So you always have redness. You have itching when you have reactive, you have allergic or viral conjunctivitis. So patients will also complain of itching. To differentiate between allergic and the viral, in case of allergic, the patients will say, well, I've been I can't move my hand from my eye. I have to scratch all the time because I have this itching continuously. In viral infection, it's ups and it's it's kind of not continuously. It's kind of breaking. Okay? So in bacterial infection, of course, you have a very clear, distinct characters which you see these actually yellowish. Or mucoplurans discharge. That's clearly tell you, well, it's a bacterial infection. In viral infection, you don't get good, more of watery, discharge from that due to increase of, reclamation. All right?
I have a question. For crusting around the eyes, the crust that's around the eyes, is that more in viral or bacterial?
Sorry?
The crust around the eye when they wake up.
Well, it depends, what you actually witness. Sometimes when people will wake up in the morning and then they have still they have itching, redness, but you don't see a discharge coming thick, a little different in color, is not white. So the minute you start to see something thick and changing color white, creamy, yellowish, this is indicator of bacteria. But of course, with expertise, working in the field for long, people can actually tell. But in all cases, when it comes to bacteria, you need to have clear diagnosis to avoid any complications. All right, we have actually, as I said, in bacterial infection, you see mucoplurant discharge. There is different microorganisms you have to think of. So chlamydia is one of them. We'll talk about the other later. But I wanted to highlight also chlamydia is sexual transmitted disease. So majority of population get affected neonates when the actually baby was being delivered through vaginal breath, when they the birth channel. Okay. So chlamydia is something very crucial. It could it could lead to blindness and complications. So when you actually suspect chlamydia, you have to make sure that you do your diagnosis and give the appropriate antibiotic. Reactive conjunctivitis is also one of the type, but this is mainly when you get an effect of something. The example that we put here, people go to swimming pool. In swimming pool they use a lot of chlor and chemicals to maintain, the cleaning environments. So those chemicals that we use to maintain cleaning environments in the swimming pool could actually, if you decide to go diving under the water, your eyes, you're not wearing your swimming glasses, So the water will come inside and then you get affected. So as a result, you end up having like also like, redness. We have an incident a few days ago that we got like one of the lab instructors. She said she started to feel like, burning on her eyes and redness. And the reason that because someone was opening like one of the bottle, like chemical bottle outside the hood. And she was very sensitive. So she started to see like, a sign of inflammation. And that mainly is like reactive. Because if she get exposed to, to this chemical, like, strong, like, fume lead to like, reaction. So when it comes to reactive conjunctivitis, you have to think of like, reason behind that reactions. Like could be a reason lead to this, phenomenon. All right, so we talk about microbial agents. I said like viral on the top list. Okay, bacteria is mainly children. But still, viral bacteria could be in all age group, but you have to remember it's viral most of the time. So the viral agent that cause conjunctivitis is adenovirus type 3, 7, 8, and 19. Measles, which is we talk about. So when you get like adenovirus, you have to think of this is the most common, and you have to think of it's mainly epidemic when you have a combination that your conjunctiva and your cornea are actually involved. So you get like, what we call keratoconjunctivitis. So, both, two structures are involved. When you have a measles, which is systemic infection, you have systemic infection, where you have like an ocular, involvement. Enterovirus 70 and Coxsackie virus, A24 is also one of the viral that could cause something called hemorrhage conjunctivitis. So this is a feature where you see like, the eye will give you indicator of bleeding. So when you look on the patients or a person who are actually suffering from this, you start to see like, a reddish bleeding around the eye. And it's kind of like scary because, I actually was experienced, I was working on my office and then all of a sudden I start to feel like, burning, and I kind of see like a drop of blood on my eye. So I ran to the dean, I remember like, I'm getting blind. So it's a viral infection, it's only need like, self, support or supportive care. So you don't really need to get panic, but of course like patients would get very panic with, what they see on their eyes. You have a bacteria like chlamydia, trichomoniasis, A and C, that mainly actually cause, trachoma, which is a leading infection of blindness. You have the serotype D and K that could cause actually inclusions, conjunctivitis, and it's mainly affecting neonatal. Okay? You have Neisseria gonorrhea. This is also very, serious. Again, it's, could affect both, neonatal and adults, cause something called hypoacute pleural conjunctivitis. And you have Staph pneumoniae, Haemophilus influenzae, and Staph aureus. That's also other, bacterial agent that could actually cause pleural conjunctivitis in developing countries. So when we zoom out on those microbes, I just wanted to highlight when you actually have an infection due to bacteria, conjunctivitis due to bacteria, so you think of Staph aureus if your patient is an adult. Okay, especially if this patient comes with a trauma, like, an eye injured, or eyelid injured, so the first microorganism you have to think of it like Staph aureus. S. pneumoniae and Haemophilus influenza and Catarrhalis, they actually predominant in children. And just reviewing our previous lectures in this block, we talk about that those actually three microorganisms are very important when it comes to children otitis media through. Remember? So, Neisseria gonorrhea, as I said, they are very crucial. They are threatening, life-threatening, infection when it comes to conjunctivitis. Why? Because, they could lead into blindness. So you need to, clearly identify the causative agent to avoid, complications. All right, so viral conjunctivitis, as I said, adenovirus, and, we'll talk about this. I just wanted to highlight that in viral infection or viral conjunctivitis, you can actually have the patients complain of other conditions. So they can come with like fever, pharyngitis, adenopathy. They can also come with upper respiratory tract. So you have to take this in consideration. Like upper respiratory tract due to viral could also be like joined with like viral conjunctivitis. So if you have if the infection reach an occur, you might be like sore manifestations. And again, it's a very high contagious infection, so you have to avoid contact. The endemic keratinoconjunctivitis is severe adenovirus, mainly from serotypes like 8, 19, and 37. Just remember the table that we just mentioned. You will have to recall this. All right. So what is the symptoms or the clinical presentations of the patients when they actually come and complain about this conjunctivitis? So in viral, as we said, before, you have the redness and redness in the white of the eye. So you see like pinkish color. You have watery eyes. When you start to see like thick yellow discharge, you have to think of bacterial infection. So this is part of the symptoms. And sometimes the patient will come even if you sitting in a clean conditions, and so still you can have the feeling of there's something moving on my eye. So people might complain of I feel there's something on my eye. Patient might also complain I have the feeling of burning, this heat. Sensations, itching of course, and sometimes the eye itself might be swelling. So all this is most of the viral clinical presentations or symptoms or complaints of the patients. But when it comes to bacteria, as I said, your eyes could be red, but still you have a clear plurant discharge, which is a very clear identifications of involvement of bacterial agents as and then this is like an image where I said you have a hemorrhage conjunctivitis, which is this is how the eye will look like, and people get very panic and think this is something could be very severe, but again it's a viral infection and it could be controlled by supportive care. But something also I would like to mention, you should always, when you actually look for, or meet a patient, so you should take the history, because with the history you'll be able to direct yourself, what could be the causative agent. I mean, if someone comes with a red eye and he was actually in his sport club the night before, spending all the afternoon in swimming, pool, you don't want to just rush and, think of viral. This could be just an allergy, it could be due to exposure to chemical on that swimming pool. So you have to take a history, because the history will help you to identify the details of the causative agent. Okay, so when it comes to diagnosis, again, when it's viral infection, so you don't really need to send sample to the lab, true? I mean, viral is self-limited, so especially if you don't have your cornea involved, so it's just a viral, self-limited, supportive care, and that's it. So when you start to see just red eye, you have discharge present, you have normal vision, no keratitis for glaucoma, so you just rely on clinical diagnosis, which could be sufficient. But when you start to see discharge that more purulent nature, you actually send your your sample to lab to be able to identify what is the causative agent. And here we care about Neisseria gonorrhea or trichomonas, so because both of them are actually could lead to blindness. So you send your swab from eye discharge, and then you look for for either gram stain. So if you think of Neisseria gonorrhea, you look for gram negative, duplicocci. if you actually think of, gym system for chlamydia, you're looking for inclusion bodies that could be, appear in identical in gym system. So management, nothing to be done for viral. It's again supportive care, which could be artificial tears, called compressor when just to advise a patient to use bacterial, once a complication, as I said before, doctor might actually give you like a topical antibiotic short duration period, like up to 6 or 10 days. If you actually having high bracket bacterial conjunctivitis, that could be due to like Neisseria gonorrhea. Of course, like appropriate antibiotic should be used. All right, so what is the prevention technique? I mean, I said in the beginning, it's when it's a bacterial infection, it's mainly children. So, you have to make sure that personal hygiene is followed. You should avoid like get in touch with uninfected eyes, even among your colleagues or your siblings at home. So you have to be very careful because this could be like a way to spread the infection. Female, they should avoid use like share cosmetic materials like eye shadows, eyeliners, mascara, and all the stuff. That's very dangerous. Even like people go to like salons, like when they do like makeup, you should take your stuff with you when you go there because that would be like high chance of getting like infection from those like share stuff. Meals or eating your kids, all this could be like a way of just always remember that conjunctivitis, whether it is a bacterial or viral, they are very actually contagious, and you should be like very careful when you take this. So the second condition that I would like to talk about is trachoma, and trachoma is it's a global burden. It's almost 84 million of people got affected. So this is the prevalence level of it around the world. 8 million will actually end in having different, degree of, vision loss. Almost 3% of people affected, they get into blindness. So that's not really, little. It's a very huge, actually. The prevalence of trachoma is mainly on preschool children in endemic regions. And when we actually go into the discussion, we kind of like, figure out this is mainly, in places with the low resources, like, countries where you have like, low resources to maintain control of, of such like, infection. So you got like, both your conjunctiva involves your cornea, get into what we call, conjunctivitis. Your eyelid could be, going to scarring. So when you get into scarring, that means it could go into fibrosis as normal pathological, process. And because of this fibrosis, you get what we call trichitis, which is your eyelashes will start to drop, pull back into and then touch your cornea, which is very transparent. And that will lead to, obscurations, and the results will go into like, blindness. So it's kind of like a very, different step process, but, end result is very, complicated that, you lose your, your vision, which is very, serious. So when we actually talk about, trachoma, as I said, like it's it's a very, it's a chronic infection, but also one have to, to highlight. So in order to think of like causative agents and transmission, we know that we talk about it when we talk about, trichitis, different serotypes, A to C, so A, B, B, A, and C, that actually is the causative agent. The disease is actually transmitted through like, flies reaching near the eye, and they can actually transmit the vectors. If you actually have, contaminated fingers, could also be the reason to, get the disease. It's prevalent where water access is poor, so people don't have clean water or poor access to the water access that will obstacles people of washing their hands and faces quite often, and then as a result they can actually. So if you think of trachoma, it's more kind of say like a disease of poverty because and overcrowded populations and low resources populations. So mainly people who have exposed or lived in a rural area, they are actually in highest to be exposed to such infection. So this is a primary driver of this infection when you live in overcrowded environment or you live in poor institution where government in limited resources to have a control of the vector, because this is one of the major causes of the infection. So when we actually think of the progressions of the disease, I already mentioned that. So what you get infection with chlamydia. So the chlamydia infection could actually lead into inflammation process in the conjunctiva, the upper eyelid, and then because of the repeat infections, continuous repetition of infection, that could lead into what we call scarring or scarring of the eyes, leading to what we call trichitis, so which is cornea braces. And of course, with this continual process, that could lead to irreversible blindness. So if you remember, the life cycle of chlamydia, that will help you to, just, get connected. So diagnosis, as I mentioned before, you use gemcitabine, and just gemcitabine is will give you clear identification of intracytoplasmic, elementary body of chlamydia trachomatis, which is, it's a clear diagnosis. You see it, you probably see it in your POD. One thing that I have to mention, PCR or molecular technique is really highly insensitive. But unfortunately, when we talk about disease itself, we talk about it's a disease of rural area and overcrowded populations and limited resources, which make it PCR is kind of not something that's easy to be found in that regions. All right, so we talk about trachoma, so management. When I talk about management, I'm going to talk about two parts. So, I'm not really asking you to remember the pharmacology. I leave it for, the pharma group. So, but, you use oral azithromycin, which is single dose that, preferred. You also can get deoxycycline, an alternative for topical and oral. But if you have, trichitis, so surgery recommendation to be able to do liter rotations is really preferable. Getting back to what we just talked about, that it's a disease of poverty, overcrowdedness, and poor resources. So when you talk about management, so you have to think of what we call safety, strategy. So it's each letter is actually representing something. So when you actually think of safety, that could be surgery if you have trichitis, but you also have antibiotic to treat infections, and you should actually have facial cleanliness or personal hygiene, or educate people about personal hygiene to avoid a chance of contaminations. And of course, crownness contributes. So you wanted to make sure, the environment, or improve the environment system that include, access to clean water, good toilets, and a place to actually flush or, throw your, waste. So that will actually improve the, the outcomes of the prevalence of disease in that, area. So if you follow the safety strategy, that could be a good measurement to be able to reduce disease, progression, transmission, and of course, prevalence in that regions. All right, another condition is what we call, inclusion conjunctivitis. So this is caused by trichomoniasis serotypes like D and K, okay? So most common form of neonatal conjunctivitis. So what we actually, it's associated with chlamydia, which we already mentioned that. So mainly chlamydia trachomatis is a causative agent. It's mainly seen in neonates because you remember we say chlamydia is sexual transmitted disease, so neonates can get it from, yeah, exactly. So the most important, because it's a bacterial infections and you have discharge, so you also have Neisseria that actually could, lead to like discharge. So it's very important to be able to differentiate between, a kind of infection that caused due to Neisseria gonorrhea or due to, chlamydia. So the onus of the disease is, time is actually could help you. So when you actually get, the mother coming, 2 to 25 days, to complain. So probably this is like more of like a chlamydia. So because in case of the Neisseria gonorrhea, if the conjunctivitis is due to Neisseria gonorrhea, so it's more of acute and aggressive, okay? Unlike unlike the chlamydia. The chlamydia will take like, long time before the mother starts to like, when you get like, a neonate, born. So it takes you a while to be able to tell, well, this is like a real infection and stuff. So what you can differentiate also by the amount of the actual discharge coming from gonorrhea infection compared to the amount of the discharge coming from chlamydia trachomatis. So these are the two things that you have to think of. What else I would like to mention? Both infections are very serious and very important, and you should actually, be very careful when you actually go into diagnosis of these two things. Inclusions, conjunctivitis, diagnosis, and prevention. If you have this clear discharge, you're going to take a swab, send the swab to the lab, and the swab will be from inner eyelids, surface. You do Jameson stain to identify the inclusion bodies. You do also like, molecular technique, BCR, and when it comes to prevention, as I said, like you can use erythromycin. I already applied to newborn immediately. After delivery, this could be like a standard prophylaxis if you actually aware that, the mother have actually, STDs, okay? All right, so coming to this point, we also mentioned acute hemorrhage conjunctivitis. We mentioned it earlier. We said that it's mainly like, enterovirus 70 and Coxsackie virus, A24. That could be the causative agent. We also, mentioned it's a more of a dramatic, situation where the patient will come panic. You get like, sudden bilateral conjunctivitis. You also have diffuse water discharge. Your lid will be like a swelling, so you have like lid edema. And your epithelial pancreas will be into keratitis, sorry. So, as I said, this is like a viral infection, remain viral infection, and it could be actually handled by, supportive care. All right, so management, no specific, it's a viral, but, it's, it's supportive care for 5 to 7 days would be enough. You have also, when you think of this kind of infection, you have to look for any possibility of having secondary bacterial infection because, if you actually miss the bacterial infection, complications will be actually progress, and then it could lead to blindness or vision loss. More as management, personal hygiene. Have to be careful sharing stuff with people, and so this is really important to actually be aware of. Another condition is what we call an ice tie, and I think you probably seen it either in surrounding people, and so, I mean, I personally get that, several times. So you can have these symptoms of your eye, you have like a painful feeling, like you have a pain in your eye, and you have like, a red eye lump, or sometimes it's called like, pearl or, pimple on the eye margin. It could be like, external, we call it external hortium or internal hortium, so it depends on the location. And if they actually come into, here, usually you advise the patient to use like, warm, pressing, like, support, and you should advise them to not to, force to drain the fluid inside, because that could go into complications. So just like let it come out like naturally, so with using like supportive care. So sometimes it goes into like granulations, and it's not really, you see it like this sign, it's very hard, and what we call it like, Clasian, and sometimes you have to go to, to clinic to do like, a release of this by, like help of a clinician to open this and drain the fluid inside. So the most common etiological agent in this condition is actually Staph aureus, okay? One thing I would like to highlight, if you actually go to patients who actually complain of this, like, sty eye or eyelid infections, and it's repeatable, something that will come 2, 3, 4, 5 times a year, you should actually take a biopsy from the patient, because you wanted to exclude the possibility of having, malignant, kind of like infections. Okay? So, okay, coming to the towards end of the lecture. So we're going to talk about Cousseria bulbus, or it's also known as liver blindness. So this is a Flareia nematode, the causative agent caused like, disease called onchocerciasis. It's known as a river blindness because, the vector is actually, breeding near fast-flowing, streams and rivers. And this is why we call it like, river blindness. So the major cause of the blindness and skin associated, so it's not only causing eye infection, but it also like cause like, skin disease, which we'll talk about it very, very soon. So just remember, it's a tissue nematode, and I think probably Dr. Mahabat talked about it in parasitology section, true? All right. So this it's actually very prevalent in the rural area. So where this rural community where people try to live around the river because they don't want to walk for long distance to get water. So most of the time they live around the streams, and and as the agent also like breeding on that region, they don't fly for long distance. So it's the second actually cause of blindness when it comes to like listing. So trachoma. And this is the second, in the list. So the prevalence of this disease is mainly because of the environment. So it's mainly actually because of the environment, poor environments, and poor control of the etiological agents. So you have two presentations. You have West African savanna onchocerciasis, onchocerciasis pattern, or you have African forest onchocerciasis pattern. So the African pattern is mainly actually affecting your skin, so that has nothing to do with your ocular. So the other one, the West African savanna onchocerciasis, is the one that actually affecting the ocular, so it affects the eye. So when you have the West African savanna, it's mainly you're more high risk to get like, the blindness or ocular disease. When you have the African, you're more like getting, skin disease. So the other thing that I would like to mention, so the what we call Volpicia, that's an symbionts that it's more of like bacteria. So the bacteria actually, release on that, so this is, I mean, the main causative agent for it is not like really the worm itself or the nematode itself. It's mainly like the bacteria, which we call like, Wolbachia, biptintis. So this is more of, bacterium that actually resides inside the nematode adult and microflora. So it's very essential for their fertility and survival. And then when the nematode dies, it releases this, Wolbachia. And the Wolbachia is the one actually, work with the host immune response. Antigen drives leading to severe ocular inflammation, and that's as the result will lead into blindness. So just remember, it's a bacteria, not the worm is actually behind the cause of these, trigger the, damaging of the inflammatory cascade. I'm not going to actually talk about, life cycle in details, but you remember that you get like, you get infected with a black fly, and then, the cycle starts where, the black fly will deposit the larva stage, true? And when they, deposit the larva stage, they will just enter, and then they will start to cluster in, certain, nodules, like density. After that, the adult worm, will produce microflora, and then this microflora, which is considered to be immature worms, and then the female worm will, can produce almost like thousands of microflora per day. So these thousands of microflora will be migrate through, your skin tissue, and then, will lead to causing of different symptoms. So, and then, of course, like, another black fly will come and pick up these, become infected, and then transfer the microflora into, inside the black fly, the microflora will be developed into L3 stage of infection larva, and then the larva migrate from, midgut of the, to the black, fly, and then it will infect like a new person. So, if you actually got like, skin disease, so you got nodules, and when microflora this, die, you start to see like, like sign of inflammations, rashes, intense itching, skin, depigmentation. So as you see here, in this picture, and if you actually have ocular effect or manifestations, you start to see like bronchitic keratitis, you have sclerosing keratitis, you have optical atrophy, and so on. So another disease that this nematode cause is like leprosy. I think I forgot to mention that at the beginning of the introduction. So this is the mechanism of blindness. You have your adult worm will die, then they will release the Wolbachia. Wolbachia will actually affect the immune ocular inflammations, and then the results will get like your cornea scarring, scarring, and then as a result of scarring, you get like inflammatory response. As responding to the Wolbachia release. So you just remember, it's not a microflora; it's more of like bacteria is the primary cause of the corneal damage and blindness. So in order to diagnose, you get a skin snip. This is a gold standard, and mainly depends on the site or selection by region. If you're in Central America, you go scalpel or italic crest. If you're in Africa, you go pelvic, gradle or buttocks or outer thigh. And if you're in Yemen, you go lower, calf. So slit lamp examination is helpful to visualize microflora in interior chamber. And as management, we already talk about, the involvement of the environments. And so the first thing I will do is just to be able to have a vector control. If I manage to do vector control, this should be like number one in my list, because then I kind of like, if you do insecticides, like, you just kill all the insect that actually play a major role in transmission. So you kind of eliminate the black fly breedings, and then that's what. You can also kill the bacteria form like the symbiotic, Wolbachia, that will stop the, render the female worm to be sterile of microfilarial effect. And of course, like you can actually kill the microfilarial that suppress transmission, and also like community treatment is, cornerstone of control if you get like community, directed treatments based on the privilege. وأقول قولي هذا واستغفر الله العظيم لي ولكم. Okay? Best of luck. I just want to mention a few things about midterm. Yes, dear. Okay, so I just would like to, mention something very important concerning, I give you 3 lectures, okay? So those 3 lectures will have a combinations of 5 questions each lecture. No, it will not be taken all. So my role is to put 5 questions that matching the learning outcomes. What I would like you to focus at is very important to be no recording, Allah يخليكم. Okay? No recording. خلاص, you record the lecture, that's fine.
Okay.
But you don't need to record. If I got my recording, I will get it to the assessment officer myself, and then, okay, so no recording. Am I clear? Okay, so you need to focus on, it's a microbiology. I'm not asking questions. I changed my mind.